1. Which cranial nerve is primarily responsible for phonation? A. CN5 or trigeminal. B. CN7 or facial. C. CN10 or vagus. D. CN12 or hypoglossal. Two. Which muscle is the primary abductor of the vocal folds? A. Thyroarytenoid. B. Lateral cricoarytenoid. C. Posterior cricoarytenoid. D. Cricothyroid. Three. The Bernoulli effect explains which physiological function in voice production? A. Subglottic pressure buildup. B. Vocal fold adduction. C. Vibratory cycle of the vocal folds. D. Resonance. Four. Which of the following is characteristic of spastic dysarthria? A. Breathiness and hypernasality. B. Monopitch and strangled voice quality. C. Irregular articulatory breakdowns. D. Rapid and blurred speech. Five. Which of the following best describes apraxia of speech? A. A disorder affecting linguistic formulation. B. A disorder of motor programming and sequencing. C. A disorder caused by neuromuscular weakness. D. A disorder of cognitive communicative function. 6. Hypernasality in speech is primarily due to dysfunction of which structure? A. Larynx. B. Soft palate. C. Tongue. D. Lips. Seven. Which type of aphasia is characterized by non-fluent speech, good comprehension, and poor repetition? A. Broca's aphasia. B. Wernicke's aphasia. C. Conduction aphasia. D. Transcortical sensory aphasia. 8. Agrammatism is most commonly associated with which type of aphasia? A. Broca's aphasia. B. Wernicke's aphasia. C. Conduction aphasia. D. Anomic aphasia. Nine. Which of the following is a primary characteristic of right hemisphere disorder or RHD? A. Word-finding difficulties. B. Prosopagnosia or difficulty recognizing faces. C. Apraxia of speech. D. Hypernasality. 10. The penetration aspiration scale is used to measure A. The severity of aspiration during swallowing. B. The strength of pharyngeal contractions. C. The effectiveness of tongue movement. D. The presence of esophageal strictures. Which phase of swallowing involves the propulsion of the bolus from the oral cavity to the pharynx? A. Oral preparatory phase. B. Oral phase. C. Pharyngeal phase. D. Esophageal phase. Silent aspiration occurs when A. A patient coughs immediately after swallowing. B. Aspiration happens without a cough response. C. Food gets stuck in the valleculae. D. Swallowing is delayed but effective. The most common cause of vocal nodules is A. Viral infection. B. Overuse and phonotrauma. C. Laryngeal cancer. D. Myasthenia gravis. Spasmodic dysphonia is best treated with A. Voice therapy alone. B. Botox injections into the vocal folds. C. Total laryngectomy. D. Dietary modifications. Which of the following is a hallmark symptom of paradoxical vocal fold motion disorder or PVFMD? A. Whispery voice. B. Stridor during inhalation. C. Diplophonia. D. Chronic throat clearing. Childhood apraxia of speech is primarily a disorder of A. Muscle weakness. B. Speech sound perception. C. Motor planning and programming. D. Language comprehension. A hallmark characteristic of specific language impairment or SLI is difficulty with A. Pragmatics. B. Syntax and morphology. C. Articulation. D. Fluency. The cycles approach is typically used to treat A. Stuttering. B. Phonological disorders. C. Aphasia. D. Voice disorders. The gold standard for diagnosing dysphagia is A. Clinical swallow evaluation. B. Modified barium swallow study or MBSS. C. Cervical auscultation. D. Palpation of the larynx. Which therapy approach is best suited for children with autism spectrum disorder or ASD? A. Prompt therapy. A. B. Picture exchange communication system or PACS. B. C. Picture exchange communication system or LSVT. D. Cycles approach. C. Lee-Silverman voice treatment or LSVT. D. Cycles approach. Which technique is commonly used in fluency therapy for stuttering? A. Pacing boards. B. Prolonged speech. C. Nasal endoscopy. D. Thyroplasty. SLP. Speech-language pathology is a specialized field of healthcare that focuses on the assessment, diagnosis, and treatment of communication and swallowing disorders. Speech-language pathologists or SLPs work with individuals across the lifespan, from infants to older adults, addressing a wide range of conditions such as speech-sound disorders, language impairments, voice disorders, fluency issues like stuttering, and cognitive communication deficits. They also play a crucial role in managing dysphagia or swallowing difficulties to ensure safe and effective eating and drinking. SLPs work in various settings, including hospitals, schools, rehabilitation centers, and private clinics, using evidence-based practices to help individuals improve their communication abilities and overall quality of life. Through individualized therapy and interdisciplinary collaboration, speech-language pathologists enhance their patients' ability to express themselves, understand language, and participate fully in social, academic, and professional settings. Here are 5 top beneficial uses of SLP. 1. Improves communication skills. Helps individuals with speech-sound disorders, language delays, and social communication challenges, benefiting children, stroke survivors, and those with autism or brain injuries. 2. Enhances swallowing and feeding. Treats dysphagia caused by stroke, Parkinson's disease, or head and neck cancer, preventing choking and ensuring safe eating and drinking. 3. Boosts cognitive communication skills. Supports memory, attention, and problem-solving for individuals with brain injuries, dementia, or other neurological conditions, improving independence and social interactions. 4. Aids voice and resonance disorders. Helps those with vocal strain, nodules, or medical conditions like Parkinson's improve voice quality, endurance, and health, benefiting teachers, singers, and public speakers. 5. Manages stuttering and fluency disorders. Provides techniques for smoother, more controlled speech, boosting confidence in social, academic, and professional settings.